I would love to introduce Amy Liechti. Amy is the Worksite Wellness Coordinator for the Iowans Fit for Life program, and that program is with the Iowa Department for Public Health. Amy has a degree in health promotion, and she's a certified health promotion specialist. So Amy's going to share the Healthy Iowa Worksites Toolkit that was released in last year in July, and she's also going to talk about, I found this very interesting, Amy, is going to talk about partnering with the Department of Education and focusing some of the worksite wellness efforts in Iowa on the schools. So I know I'm really anxious to hear what you're going to share with us today on that. So, Amy?
Well, thanks very much, Michaela and Teresa, and thanks to all of you who have logged on today for listening to me. Again, my name is Amy Liechti, and hello from a gloomy Des Moines, Iowa. Hopefully the rest of you are having better weather than we are, but at least the snow is gone, and I know some are not quite so lucky, so I'm thankful for that. I am going to talk about primarily our worksite wellness efforts, and as Teresa mentioned, some of the efforts that we've sort of expanded into schools, but I wanted to lay a little bit of groundwork before I got started. And Michael and I were just talking about this, and my slides are not advancing quickly, so.
Now, do you see them advancing at all?
No, I do not.
Try hitting the Enter key. Okay, there you go.
Okay, maybe that'll be a quicker process.
Possibly.
Okay, we'll give that a try on the next one. So what I had included in the learning objectives for today's webinar were to learn about the worksite wellness work of Iowans Fit for Life, and as well the collaborative efforts in place to address worksite wellness for school staff. So I actually wanted to sort of lay the groundwork a little bit, make sure everyone knows what Iowans Fit for Life is before I get started on some of those other efforts. And of course I want to give a little bit of a plug for some of the other resources that we have that maybe some of you haven't seen. So I noticed on today's registration list that there were a lot of you logging in from state health departments. So you are probably well aware, and the same thing goes for the fact that this is a State of Wellness webinar. A lot of other presenters have been from state health departments. So you are probably already aware, generally anyway, of what the work is that Iowans Fit for Life is doing. But we are one of the 25 funded states funded by the Center for Disease Control and Prevention out of the Division of Physical Activity, Nutrition, and Obesity. And we are housed at the State Health Department. We do have a staff team of about 7, I think. And our work takes place between our staff team and the partners that we have across the state. And these partners are also promoting physical activity and healthy eating for Iowans of all ages. And so our primary focus is working on policy and environmental changes that will improve the health of places where Americans live, work, learn, and play. And I just wanted to kind of quickly mention, too, that we do have our partnership broken up into work groups. We just had a partnership meeting yesterday that went really well. We focused primarily on the Let's Move campaign. And then we also have time for our work groups to meet, and our work groups are ag and food systems, early childhood, educational settings, community, healthcare, older Iowans, and then worksite wellness, and that would be the work group to which I serve as the staff liaison. Highlighting some of our recent work, and I'll try to go through this very quickly. There's a lot of information on some of these slides. It's just our system is just not cooperating with me. Hang with me. The next slide focuses on a toolkit that was produced by our healthcare work group, and our healthcare coordinator drove that project. Here it is. It's called Eat and Play, the 5-2-1 Way. And as you can see, it's an online pediatric obesity prevention toolkit for health professionals and their patients. It was developed because Jen and her work group, and her work group is comprised of healthcare professionals as well, that these physicians reported that talking about weight with their patients and their parents is a very difficult and sensitive topic, and they didn't even really know how to open the conversation. So that's really why this toolkit was developed. It does include a very nice motivational interviewing module and a variety of brochures and community resources for patients. It includes a health contract and has its own website. You can see up at the top there, eplay521.com. It has some additional resources for patients under the link that you would find if you went to that website called Kids, Teens, and Families. And so then the next resource, which probably several of you have heard about, is the Nutrition Environment Measures Survey that was created by our nutrition coordinator, Carol Voss, and a former Iowa State University Extension employee Susan Klein. NEMS-V complements the other NEMS tools that are currently available for grocery stores, restaurants, and convenience stores. This survey assesses vending machines, and that's primarily in Worksites. So the purpose for bringing that up, obviously, is this is a nice tool that Worksites can use to assess their vending environment. And the criteria used to determine whether food is healthy is from the Institute of Medicine. That's how they based their assessment tool and the calculator that they use. And so then the items in the machine would be categorized as green, which would be the healthiest option, yellow, which they're calling a healthier option, and red, which they did not say isn't healthy, but instead said it's not as healthy as a green or yellow option. So you can go to the NEMS-V website to view. There are tutorials and information on how to conduct an assessment and many other related resources. And that's really what another piece that's shown on this slide is some nice reports that can be generated. The one on the right would go on an individual machine and show that that machine earned an award if it qualified. This particular example says that the cold beverage vending machine located in the basement at the Iowa Department of Public Health has earned a gold level award. So that can be posted on the machine. And then the report on the left really gives you a snapshot of all of the assessed machines in one particular work site. So you can see there it says that IDPH has earned a gold award. So that's kind of nice for a worksite to showcase that and be able to promote those healthy options to their employee population. And then finally, I wanted to highlight some of the resources that were developed out of our community work group, and some of you may have seen these. This particular tool is a walkability assessment. It's called Walking with a Purpose, and obviously was used to assist communities in assessing the walkability of their community. It was actually designed to specifically help schools identify ways in which the route to school could be safer and more walkable for the children attending that school. It has been used, though, by quite a large number of communities across Iowa. So I know that one of the next pieces of work for that work group is to revise this tool and make one more specific to schools and another one more specific to communities. I wanted to highlight as well in this orange box over here where my cursor is, we have given out some mini grants to our community wellness grantees, which I'll touch on, and some of our basics contractors to use this tool in their community and report back to us what they're doing. And we have posted their success stories on our Iowans Fit for Life website. So those are kind of interesting to read, find out more about what they learned about their community. This document is exactly what it is called, Low-Cost Ways to Make Your Community Healthier. Just a kind of a quick reference guide for communities on, and they're kind of divided into categories, things they can do in their community that would be extremely easy. Sort of the middle category is called you'll get by with a little help from your friends, so maybe a little bit more coordinated effort for some of those activities. And then the final category, which is actually on the back side of this document, which you can't see here, is those kinds of initiatives that may require more of an organizational approach to improve the health of your community. And then the final piece I wanted to highlight before I got right into the worksite specific stuff was this asset mapping guide that we have created. There's a facilitation guide that can be found on our website, as well as links to a physical activity mapping guide and a nutrition mapping guide. And this resource was developed to help community coalitions identify their nutrition and physical activity strengths, and it's primarily asset focused. So what things are happening that are positive, but it also will help them identify areas where in which they could improve, and kind of highlight the gaps, and then it helps them to make a plan in going forward for maybe where they're missing pieces, activities are missing, maybe they have people who should be at the table at their joining their coalition who are not. So we have used this tool with a variety of our community wellness grant projects and other grantees with a high level of success. They have reported really enjoying the process, and it has helped them kind of identify those assets and weaknesses in their communities. So, okay, what's going on with Worksite Wellness in Iowa? Before I get into the development of the Healthy Iowa Worksites Toolkit, I wanted to highlight some of the other things that we've been working on. Many of these efforts that you see here on this slide were in place prior to the development of the toolkit, which really kind of further justified the need for a resource like the toolkit that was developed that could be utilized by businesses, and it would be primarily small businesses, to implement or enhance their worksite wellness program. So backing up a few years, in 2008, House File 2539, which is more commonly referred to as Iowa's healthcare reform legislation, was passed, and it was a large piece of legislation that contained quite a variety of efforts, and it included the requirement for the Department of Public Health to write a small business qualified wellness program tax credit plan. So a committee was convened of key partners and stakeholders, and they formed to write the plan. And most of that plan actually was written before I started. I got in right on the tail end of it. That particular plan was in large part based on the plan that had already been implemented in Indiana, which I know you have heard about on one of these webinars. Iowa's plan then was sent back to the legislature during the 2009 session. It was introduced in the Senate and referred to committee, and that's really where its life ended as far as the legislative process is concerned. You know, it did have a fiscal impact, and as many states are experiencing right now, if there's a fiscal note attached to legislation, it gets scrutinized in a little bit more strict manner than it maybe would have been, you know, a few years ago. So it did not get enacted, and the plan and all of its components are still available for reference. We are hopeful that it may once again be introduced by our General Assembly and passed into legislation. That same piece of legislation, Iowa's healthcare reform, created an appropriation for the Iowa Healthy Communities Grant Initiative, and that's the second bullet point on this slide. The legal applicant for these grants is the local boards of health, and Iowa has 101 local boards of health. Their projects must focus on at least one of 6 suggested focus areas, and they would be nutrition, physical activity, chronic disease prevention, oral health, mental health, or tobacco cessation. So I included this effort for a couple of reasons. We do spend a decent amount of time, our staff team does, staffing and providing technical assistance to these projects. We all are assigned projects that fit into our focus area, and several of them have either solely a worksite wellness focus, or worksite wellness is a piece of what their grant application included. So the toolkit that I created and several of the things that are happening with regard to worksite wellness are happening through these counties that have been funded through this appropriation. We used to have, we do not now, and again would be hopeful that maybe in the future we would have what we called funding. It was Harkin Wellness Grants, and it was funding from the federal government through one of our state senators, Tom Harkin, to fund these kinds of kinds of projects, and when that legislation was passed here in Iowa in 2008, that was really a match to those federal dollars. So for a time, those projects were funded out of a mix of federal and state funding, and they're currently just state funded. And so I wanted to show on that final bullet point some of the other partners that we have here who have been focusing on Worksite Wellness, some for quite some time. The Wellness Council of Iowa, which is an affiliate of the Wellness Council of America. The Healthier Workforce Center for Excellence, which is housed at in the College of Public Health at the University of Iowa. They're funded by NIOSH, and they're only one of 3 centers who have received that funding to do this kind of work. Live Healthy Iowa, Iowans Fit for Life. We've got insurance providers who are on board, and there are quite a few other partners who are putting a little bit more focus on worksite wellness. So these efforts that I just highlighted and the Worksite Wellness focus of our other partner organizations really indicated that the time was right to create the toolkit resource and begin to make more of a cohesive effort toward improving the health of Iowa's workforce. So the data on this slide is not unlike what many of you are probably experiencing in your states too, but it really kind of solidified our desire to do so, gave us some more of that justification. So like I said, Iowa's not unlike any of the other states. We're experiencing trends that are similar to national trends, but the stats listed here provided us with the evidence we needed to put some time and effort toward the toolkit. So we are currently looking at an overweight or obesity rate in Iowa of 67.2%. So according to the Trust for America's Health F as in Fat report, that ranks us at 22, excuse me. I included, this slide I've actually used for a variety of other presentations, and I include the childhood obesity rate because we know that children as dependents are oftentimes covered by the employee's insurance, and with employers looking at those healthcare costs, it's important to keep in mind the health of the dependents as well, and you all know that. Working Iowans and working Americans really are spending more than 40 hours per week on work and work-related tasks. That fourth bullet point is information that we get from an independent survey firm. They do an employee benefits survey every year, and that particular firm is called David P. Linden Associates, and we order the full report after that survey is conducted each year, so we can be apprised of what he's finding, and maybe he asks some questions too about what employers need, and wellness usually is included in there. But the 2010 study showed that healthcare costs are increasing at an average rate of 13% across all employers in Iowa. The 2009 report showed that rate was 11.1% increase, then that was the average. So they continue to increase. That's what that's showing us. And then the final bullet point, I don't know if others of you know how many small businesses you have in your state. I'm guessing you do. We determined, or had to find that number basically, when we were writing the justification for the Small Business Qualified Wellness Program tax credit plan, because the tax credit would have been made available to small businesses, obviously, and we defined that as having 2 to 100 employees, and we found that Iowa has more than 91,000 businesses in that category. So that's a ton, and as many of you know and have experienced in your own states, it's really those businesses who need access to resources and probably do not have the capacity to have a full-time wellness coordinator and really put forth a real cohesive effort starting from the ground by themselves. So the groundwork really had been laid, and the data certainly showed that a Worksite Wellness effort related to the development of the toolkit was needed here in Iowa. So what did we do? Well, we applied for and were granted funding in 2009 by the Iowa Cancer Consortium to convene some, it's really easy to call them focus groups, although I did receive information or a question from a researcher at one of our universities who was asking about my methodology and how I was selecting participants. So I decided to really stop calling them focus groups, and they were really called, I've called them listening sessions. What I really wanted to learn was from employer groups that did have a wellness program, what do you wish you had when you started, and what are you doing now that is successful? and then as well from employer groups and organizations that did not have a wellness program. What would you need to get started, and would a toolkit resource be helpful to you? So we conducted those groups with small employers, obviously, in Iowa, and the representatives were from both urban and rural areas, and like I said, they did have wellness programs in place. Some did and some did not. I required that the ones that did have a wellness program in place be a results-oriented, comprehensive program. So I determined that by the fact that they were a designated well workplace through the Wellness Council of America. So I've already mentioned some of the kinds of questions we asked, basically getting at what kinds of things would Iowa employers need to have included in a toolkit resource. So thank goodness for interns. I did not know, the rest of you who have developed toolkits, which are fabulous, and we have referenced in ours several, know how much work it is to put something like this together. And so I had a very competent and capable intern who was a self-starter, and she took that information we got from our listening sessions, analyzed it for common themes, and began to organize it in a logical way. And so today you can see right there a little clip art image of what the toolkit looks like, the final product. And boy, was I glad to get that hot off the presses last year about this time. So this slide just gives really a kind of a quick overview of the kind of content that is included. Those of you who download resources and know about the benchmarks, the 7 benchmarks from WellCOA, will note that obviously a lot of these things are similar kinds of efforts that need to take place in a worksite to implement a good or results-oriented wellness program for employees. It was not our intention to recreate what WellCOA had done, certainly not. This information is really quite a lot more basic, I would say, ground level information on really how to get started. So we had our, who is now our former director of the State Health Department, Tom Newton, submitted the foreword. That is one piece I'll need to revise because we do have a new agency director, Dr. Marionette Miller-Meeks, and she has agreed to include some information in the toolkit about her support of these kinds of programs. So then obviously we've laid the groundwork in the Why Worksite Wellness section for why it's important. Gaining support from the top, unions, and as well financial officers. I got a lot of feedback in our listening sessions that it's really nice to have support from the top, but you have to have it from that person who has more control over the purse strings, because oftentimes what I was hearing was these people were saying, oh yeah, our CEO was 100% behind the idea of implementing an employee wellness program, and then it was our CFO who would go, well, wait a minute, what's that going to cost, and looking for a few more of those details related to the dollar signs attached to such an effort. So that kind of information on how to gain that support is included. Forming a wellness team, we know if a company only has, generally if a company has less than 25 employees, they're probably not going to form a whole team to address wellness, but find the champions, identify those people who are willing to volunteer some time and have the approval from their manager to do so, to collaborate and take on different tasks for what your wellness program will be. So that's what's included in the Forming a Wellness Team section. Assessing needs and interests, we obviously know that HRAs and employee needs and interest surveys and health culture audits and things like that are so important to determine how your wellness program will shape up. Putting together a work plan, planning your programs, and then information on marketing them. The implementation section really just includes what we heard were common challenges that work sites face, so things like participation rates and things like that. It includes some suggestions on how to overcome some of those common problems. Evaluation we know is important, and especially if you're justifying the need for your program, and right now we know that a lot of wellness programs in organizations are needing to do that. Evaluating is so important. And the appendices includes disease-specific information and other pieces of information that were written by partners of ours. So it includes stuff from other health department programs like heart disease and stroke and diabetes and tobacco, and certainly cancer. They were a funder, the Cancer Consortium of Iowa, that is. And it also included in the appendix a lot of different sample forms. One particular piece of feedback I got from someone who was working in a county health department was, I take this on sort of as just my passion and something I want to do, I think is important to do for employees, but it is, by no means my full-time job. She said she spent an inordinate amount of time trying to find a sample release of liability form she could use with her employee population, because they were going to start doing like an after work hours aerobics class of some sort. She wanted the people participating to sign off that they would not be liable if something happened during that class they were taking, but she said she spent a ton of time trying to find one. So we included a sample in the toolkit. And obviously with the sort of disclaimer all throughout, check with your legal counsel before you do use these forms or implement some of these kinds of programs. And certainly from the perspective of legal considerations, HIPAA and the GINA laws and things like that, make sure you're compliant. So that's what's in it. I've been tracking, although not in a very formal manner, on a piece of notepad paper where I'm presenting on the toolkit, where they're being handed out and distributed. We do have the capacity to track downloads and page hits from our website, so we do keep track of that information, although that application right now is not working, so I don't have that number today. But I have gotten all kinds of good feedback that they needed something very basic and that this resource has been helpful. It's fairly short, it's right about 50 pages, and I purposely tried to keep it that way because what we'd heard from a lot of our listing session participants was I would have no time to pick up a document that was very large and try to digest that information. So we know those kinds of resources exist out there, and for those companies that are looking for more, definitely refer them to those other resources and link to them in our toolkit. We tried to keep ours pretty brief. So I did apply again to the Cancer Consortium for a mini grant to conduct some pilots of the toolkit. And I'm not doing very many, and I did not have a ton of time to do it, but I just wanted really what I wanted them to do was take the toolkit and with little involvement from me, just see what you can do. And that's what they're doing. And they should be wrapping up here shortly. I had one of the pilot sites is a collaborative effort between a local YMCA and a bank, which I was purposeful about. We do have, Iowans Fit for Life has formed a strategic partnership with our state alliance of YMCAs, and I don't know that all states have a state alliance, but Iowa formed one just a couple years ago to gather some of the CEOs from some of the larger YMCAs and smaller ones to try to have a more cohesive effort with regard to the focus areas of the Y. And as you know, the YMCAs focus on quite a lot of things, but basically the betterment of their community and its residents. So I wanted YMCAs to take this toolkit and say, let me know if you can use this with an organization in your community. So that's what's being done right now at a bank in Keokuk, Iowa, over on the Mississippi River. And then we have one in central Iowa. We have one in western Iowa on the Missouri River. I will tell you honestly, it was kind of difficult for me to identify some of these sites because what I am largely aware of is work sites that have comprehensive wellness programs in place. I was really looking for small employers that didn't have anything in place. So worked through some of our partner organizations to identify those businesses, and then really had to work with them too on why participating in this pilot would be beneficial to them. So what I needed to find was a small business with no wellness program that was motivated to implement one right when I was looking for participants. So I got some good ones. They've given me really great feedback so far. I have not submitted to them yet. It'll just be via SurveyMonkey, their means for submitting a final report. But I anticipate making some minor revisions. I already know that I know John Morgan from Wisconsin told me one of the calculators I included is no longer free, so I'll take that verbiage out of there. And the new forward information from our new agency director will be included, and then any other revisions that they suggest, the pilot sites suggest that I think would be helpful for all, will be made yet this spring. And so some of the other things that we're thinking about is potentially gathering interested partners and stakeholders for a workshop or a Worksite Health Summit or something similar to that, and that might be done next spring. And then we might also consider the Wisconsin model of doing train-the-trainer workshops, and I'm envisioning there that would largely be YMCAs and other organizations like that that are working with businesses in their communities on Worksite Wellness, or even just improving the health of their workforce. However they're doing it, that we could convene those groups of people and really put some more legs underneath our toolkit across the state of Iowa. But I've been very pleased with the feedback I've gotten so far, and anticipate that will continue. Certainly I hope it will. So that is the Healthy Iowa Worksites Toolkit. And so Teresa mentioned we have been doing some work with schools. So why are we focusing on schools? Well, all of you understand the importance there, and I included, this was actually a little comic that I got from our Department of Education, where a student is complaining that healthy stuff's been put into the vending machine, and the principal says, yes, I know, the school board decided to do that because kids are eating too much junk food, and of course the child thinks that's not fair. And the principal understands and says that, you know, that's now our new policy, so there will only be healthy snacks in there, but he has a stash of unhealthy things at his own desk. So that's really what I would call anecdotal evidence. I'm not even really sure that's evidence, but we know that those things are happening widely. So the Worksite Wellness Work Group of the Iowans Fit for Life Partnership decided in 2009 they thought a focus on schools as work sites would be a good project to undertake, and include that. We included that in our work group's action plan. Initiative, and we all got to work. These partners were our State Department of Education, Live Healthy Iowa. That is a sort of an arm of the Live Healthy America Challenge. If you're familiar with that, we have a Live Healthy Iowa Challenge. They have a kids challenge called Live Healthy Iowa Kid bought into this project are basics contractors, and those are the contractors that work through SNAP here in Iowa with schools that have school buildings that have greater than 50% of the students receiving free and reduced lunch. And then our state's largest insurance provider, Wellmark Blue Cross Blue Shield. All of these have been primary players in our efforts. And I really feel like in Iowa we had gained some momentum on this issue and focusing on schools with the passage of our Healthy Kids Act. That legislation passed in 2008. They're related to physical activity and nutrition. And the nutrition piece obviously does not relate to school lunch, but primarily competitive foods, fundraisers that are done, and vending options in schools. So in trying to meet these standards, I believe that awareness was increased related to the issues, and schools had needed to start looking at these efforts not only as they related to students, but as they related to staff as well. So the Department of Education, and more specifically the Team Nutrition Program, which is also led by the Healthy Kids Act Director, began to encourage staff to be good role models and to adopt healthy behaviors too. So what are we doing? Well, schools are a tough audience to reach. Our first effort was to determine how many of our about 360 school districts even have a Worksite Wellness program. So the first thing we had to do was send a survey to all of the district superintendents, and the Department of Education gave us that list, and we asked them for the contact information for their school wellness policy coordinator. So then when that information was sent back to us, we developed a new distribution list that we use to send out the survey, and our evaluator with Iowans Fit for Life played an integral role in this. So we surveyed these individuals to learn more about their nutrition and physical activity environment, and to also ask about the existence of a wellness program for staff. So knowing that most schools did not have much of a wellness program in place for staff, I tried to keep these questions very brief, so it really was only 2 questions that went into there related to staff wellness, and they were, do you have a wellness program for staff, and if so, what kinds of programs are you offering? And that was a pretty brief list, and we allowed them to fill in an open-ended text box if they were doing something that I hadn't listed. As you can see on this slide, 2/3 of them responded that they don't have a program. And actually what I put on the slide is that was a survey done in 2010. We've done 2 surveys. We did one in 2009. We did another one in 2010. The survey showed about the same thing, which at first glance was a little disheartening. But I then thought, well, you know, I should be thankful that none of them are reporting less staff wellness program offerings. So I guess we held steady on that count. And this is probably not a surprise to many of you. Like I mentioned, schools can be so difficult to reach and to target because teachers and staff are already facing so many requirements and mandates that they have to meet. And we in Iowa are having pretty big budget concern related to allowable growth funding for schools now too. So adding one more thing to their plate oftentimes is seen as just too much, and certainly meets with some hesitation and in a lot of cases resistance. But we are making the case, and we're sharing this information with them that specifically relates to the ways in which students benefit. We kind of out of the gate focused on how the staff will benefit, and that still is included on, you know, the typical things of improved productivity and increased morale and things like that, but how does that impact the students? So those are the kinds of things that are on this slide. This is a slide that I include in a presentation I've done on Worksite Wellness at some of the role modeling workshops that our team nutrition program does. And so I think this tends to resonate a little bit more with the audience, and generally the audience is comprised of PE teachers, school nurses, food service directors, some administrators, and even sometimes some concerned parents. And the parents may be representatives of their district's parent-teacher association, or even just concerned parents. So we focus on things like the teachers are absent less often, they need to bring in substitutes less often, and that provides a lot more continuity for the students. A healthy teacher is better equipped to handle stress, which is a top health concern that's reported by teachers. And then certainly a healthy staff does a better job of teaching and creates a better working and learning environment for the students in the school. This document that you can see, obviously you can't read it, but you can see what it looks like, and it is available on the Iowans Fit for Life website, was developed because we heard from a lot of the schools that we provided a hard copy of the toolkit that we need something even shorter. So we came up with something that was pretty short, I would say, with about 50 pages in the resource kit for the small businesses in Iowa, but schools were saying that's still too much for us. Because they don't have a staff person who takes on employee wellness in many cases. Some of our districts do, but I would say I can probably count them on one hand, the number of districts that take on employee wellness and have a dedicated staff person to do that. Or even in the case of Iowa being fairly rural, we have a lot of schools that are consolidated, so kids are being bused all over, and the school is broken up into, well, the school that I went to, for example, the elementary and high school are in one town, but the middle school is in another town. So you don't have someone at each site putting Worksite Wellness into action, although it would be fantastic if they could identify a champion at each site. What we decided to do is give them a smaller scale resource that would be a place for them to start, and another one of those quick reference guides like the low-cost ways to make your community healthier resource I showed you at the beginning of this presentation, for some easy things they can do to positively impact the health of their district employees. So that resource is what's pictured here. It's called Making Worksite Wellness Work at Your School. Its development was a collaborative effort between the Department of Education and their team nutrition program. the Iowa Department of Public Health and Iowans Fit for Life, as well as our nutrition network's Pick a Better Snack campaign. Some of their resources have been included. You probably can't see it here, but this document is divided into 4 sections called Get Started, Build Support, maybe you can see it, I guess I can read it, Partner with Others, and concludes with a listing of other helpful resources. And it has been distributed widely at the role modeling workshops, again, that our Team Nutrition program has done, and I believe they've done probably 6 or 8 of those, and they just started doing them a couple of years ago. I know they did 4 last fall. One in particular that I presented at, which was held in Coralville, Iowa, which is in Johnson County, where Iowa City is located, if you're at all familiar with Iowa. They had 100 people participating there, which was phenomenal. I thought it was really great in attendance there. So they were given the toolkit, the Healthy Iowa Worksites Toolkit, and they were also given Making Worksite Wellness Work at Your School. We've distributed it to our Iowans Fit for Life partnership, to some of our community wellness grant projects, and our basics contractors have been given this resource as something they can share. The basics contractors may or may not be an employee of the school district they serve. So it's a little bit easier if they are a staff person for that district, but they are not always. Some work for the local extension office, some work through public health, that they have received this resource too. And we've written newsletter articles for, it's called the Basics Banter, that our nutrition network puts out on why focusing on staff wellness is important. And it was actually the feedback I got from that staff person here at IDPH that making a concerted focus on how worksite wellness in a school affects the students would be helpful. So I think that was very worthwhile feedback. So this document is making its way out and through all of these partner organizations. In the process of working with some of these schools and providing them information, we're also asking them for their feedback. I've included a list here of some of the things they've told us are working in their district. We did, as you can see there in italics at the bottom of the slide, a webinar called Taking School Wellness to the Next Level last December. We had about 100 people log on to that webinar, which again I felt pretty good about because it was at like 3:30 in the afternoon, and so that's time frame when school has let out, so those staff that participated were staying to participate in our webinar. And we did quite a few polling questions in that webinar because it was really our intention to learn from them that day and on that webinar. So as you can see, a lot of what they told us was working in their districts are mostly low cost or easy efforts that in many cases might be considered sort of entry level, but certainly it's a start, and we share this information with others. It gives us a good idea of where they are and then kind of helps us to formulate a plan on what kinds of information we need to get to them to bring them to the next level. We also learned from them that hosting a webinar like that one that was done in December quarterly would be helpful. So we did a follow-up. It was not a webinar. It was an ICN session. That stands for Iowa Communications Network. We have sites across the state where people can log in, and it's more like a antiquated video conferencing methodology we can use. So we can see the people when they ask questions and things like that. We did that session in March, and those presentations were done by the Department of Education, myself, and then Iowa State University Extension has developed a couple of different tools or programs for worksite wellness. And they are available for a fee, but the local extension offices are willing to work with districts with regard to what they may be able to pay if they wanted to utilize any of those programs. So the final thing I wanted to highlight was the Healthy Iowa Awards. October 1st of 2009 was the inaugural presentation of the Healthy Iowa Awards. And these awards celebrate the healthiest schools, organizations, and individuals in Iowa. And I want to clarify that it's not a Worksite Wellness Award necessarily. As you can see, the awards are the Healthy Iowa Community, college or university, K through 12 school, and then we do give awards for Healthy Iowa Visionary Leader or Emerging Leader. The College and University Award as well as the K through 12 School Award are specifically for those organizations as a work site. So what kinds of efforts are in place addressing the health of the faculty and staff at the college level, and the same thing for the staff and teachers in the K through 12 school districts across Iowa. There are lots of things going on addressing the health of students and recognition schools can receive for those efforts. The primary one that that we promote here in Iowa is Healthier U.S. School Challenge, and we do have quite a few schools who have received that designation, and they are also honored at this banquet. So we were really looking more at those people who can make an impact on the students in those settings for those two award categories. And then as well, to get the buy-in from our Wellness Council, we needed to steer clear of the Worksite Wellness Awards and leave those Well Workplace designations up to the WellCOA process. And so those work sites that are honored with a bronze, silver, gold, or platinum level WellCOA designation are also awarded those awards or plaques at that banquet, which is usually held in the fall here in Iowa. This effort, we say, is put on by the Academy for Healthy Iowa, so sort of an Academy Awards theme, which is a collaboration between the Iowa Department of Public Health and our Governor's Council on Physical Fitness and Nutrition, and then the Wellness Council of Iowa is integrally involved. They promote these awards, and then they also, we contract with them to administer the process. So they take care of all the details of reserving a space and getting the food and the awards that are given out. The Governor's Council actually developed the criteria for these awards. So when it's time for these awardees to be honored, the Governor's Council presents those awards to them. Those who do win a Healthy Iowa designation are designated for 3 years, and then after 3 years they would need to reapply. We got some feedback that the application process that we utilized in the first 2 years was a little cumbersome. They do not get money. We got that question a lot. What, do we get any money if we receive this award? No, they do not. In fact, they don't get money if they get a Well Workplace Award either. So nobody's getting money. They do get a nice plaque. What they get that has been very beneficial, the feedback we've received is good, is the Wellness Council sends a videographer out to do a nice video of the efforts in place at the award-winning organizations. So as you can imagine, for the communities that are the winner, that receive this award, they use that video as an economic development tool, and they said that has been really beneficial for them. So you can learn more about the Healthy Iowa Awards and some of the past recipients we've had. We've had some really good ones. In fact, you can see there in the last category, the Healthy Iowa Visionary Leader or Emerging Leader category. We actually expanded to include Emerging Leader in the first year because we received a lot of applications in that category, and one that was really phenomenal for a young man who was in high school and had actually was headed off to Iowa State University the next year, so he was a senior. But he was doing things with school kids in his community, and his community is a really small town in northwest Iowa called Hull, through 4-H groups and FFA, and working with these kids, telling them, teaching them about the importance of healthy eating and physical activity. So we expanded that category to include emerging leaders, which are typically that category would be for 25 and under, and then the visionary leader would be for 25 and over, and oftentimes is a leader of a company who's doing great things, or a health department official, a variety of different people who are doing great things as it relates to improving the health of Iowans. So with that, that sums it up. That is the content that I had for my slides today, but I'm more than happy to take questions. I just want to put a little disclaimer out there. If you have questions about things that don't necessarily relate to Worksite Wellness, I might not have the answer, but I can get them for you. So, Michael and Teresa?
Yeah, well, I wouldn't have thought of asking a question that didn't relate, like, what's the meaning of life? But,
Well, I was thinking, even for some of the other programs here at IDPH, might not be the one who has all the info, but
Ah,
I would
okay.
do my best.
Okay, well, never mind then. Okay, well, yeah, we do have, Tracy, you there?
Yes.
Okay. I've got 3 questions at the moment, so let me, I'll go ahead and give you those, and if you have questions or if you want to do something crazy like raise your hand and speak directly, you can do that. You can speak with Amy. I can unmute your microphone. Most people don't want any part of that, but there are some brave souls out there, so whichever, but if you want to just type your question, type it into the questions box, and then I can make that question, I'll read that question to Amy. So, okay, let's see. Tony wants to know, what was the name again of the firm that you received that information about the increase in healthcare costs? I think it was Why Focus on Workplace Wellness slide?
The piece of information that said healthcare costs are increasing at an average rate of 13% across all employers in Iowa.
Yeah.
That is done by an independent survey firm in Iowa for Iowa employers, and it's called David P. Lind, L-I-N-D, and Associates.
So, yeah, he was interested in using it in his state, and it sounds like you have to find a similar, or she would have to find a similar provider.
Right. I would say that would be the course of action, and I have talked with David P. Lind, and he is super nice. I think he'd be willing to share sort of their methodology and what they're looking at to collect this data too. So.
Well, I wonder if that wouldn't be available from the State Chamber of Commerce.
Yeah, could be.
Yeah, I don't know.
Check with.
Yeah, let's see. Tim wants to know, what's the largest firm in your state using the toolkit, and is it any more or less helpful depending on the size of the organization? Are you getting that feedback?
Well, so my quick answer is, unfortunately, I don't really know. With this kind of resource, when we post it on our website, it's kind of hard to tell for sure who is using it. But the feedback I've gotten is that it has been most helpful in those smaller businesses, and I would even say, so we define small businesses 2 to 100, but I would say even 50 and less. And actually, of that 91,000 number I gave you, 88,000 is in the 2 to 50 category. And those that do not have a wellness program in place, we really wanted to partner with our local wellness council to provide the sort of the second tier level of resources. So what we put out is fairly basic, and that's the best feedback I've gotten is from those companies that have no wellness program in place.
Well, to me that seems to make a lot of good sense, because Teresa and I have talked before about how there are often so many great resources out there, but to actually make it usable by someone in a company is a challenge.
Yes, and what we have recognized in our own staff team is that we try to give people, in many cases, way more information than they need, because we want to make sure they have all the information. But if you put too much in there, then they're more likely to not read it at all. So, and that's really the kind of the feedback that we got too when we developed this resource. So,
Teresa?
Yes, one question would be on, Amy, you mentioned the different organizations doing great work, especially around worksite wellness or prevention in Iowa, and I know we're seeing that in most of our states, but so just curious of kind of what strategy you've used to work with all the different partners and to not maybe overlap or kind of, go over into someone else's category of what they're doing. So what would you tell us on how you've been able to work with all the different groups in your state?
One of the very basic things that we've done is just make sure that those partners and collaborators are on our partnership list. Whether or not they can come to our partnership meetings, they get the information we send out to the partnerships so they have an idea of what we're doing. And so that keeps them apprised of our work and then hopefully eliminates some potential overlap. I'm sure many of you have experienced the exact same things we have in the last few years of, well, that group's doing that and so are we. it's so similar things taking place by different groups, and we didn't even know it kind of phenomenon is what it kind of seems like sometimes. And so I think we've been able to do a little bit better job because we have more capacity through Iowans Fit for Life than they had a few years ago. We have a little bit larger staff team than started the program. So we can really kind of hone into our own focus areas. I work specifically on Worksite Wellness. We have someone working specifically on healthcare, ag and food systems, community, educational settings, and so we can identify those partners a little more readily than maybe could have been done in the past. And I think even just recently with the costs that organizations are facing, you know, people are really seeking out the partners that can help and build capacity in these areas. So we haven't had to do a lot of work, but, you know, and it's always sort of the word-of-mouth thing. You know, I'll meet with the Wellness Council of Iowa, and I said, well, did you know that this group's doing this? And we then have the capacity to reach out and make sure we're all kind of on the same page and focusing on the same kinds of things. I am not sure if that really answered your question, but...
You know, Amy, it really did, because I think what you're saying is sometimes we can identify those organizations and say, like, you could do a good job in Iowa, but sometimes there's some that maybe we'll miss or whatever. So you just make sure that it sounds like you invite all that you know about and kind of put the word out that you want to partner with all of them, and then being really open and transparent about the work that you're doing. I think those are kind of what you said, and I think those are key.
Mm-hmm. Yeah. Yep.
So, yes.
And, you know, we routinely ask at our partnership meetings or of our work group, is there anyone who should be at the table that isn't? It seems like that would be an obvious, but sometimes that gets missed when you see the same faces and you're working on the same things. But occasionally they do say, you know what, there's this group doing, you know, whatever that would be helpful for us to know more about and collaborate with. So we put that question out there a lot.
Great.
Great. Well, anything else, Teresa? I wanted to carve out a couple of extra seconds at the end here to talk about some upcoming things. But before I do that, of course, I want to thank you, Amy, for being here today. It's wonderful to get to hear what Iowa is doing and compare and contrast what some of the other states are doing. I think it's really interesting. It's interesting generally speaking, but for people who are, you know, in the midst of putting things together, I think it's invaluable.
Yeah, this series of webinars has really been helpful for us too, and I really am thankful for the opportunity to talk a little bit about what we're doing, and I just want to thank everyone for logging in today.
Awesome. Well, thanks so much. Let me say that this has been recorded and will be available on Health Promotion Live and on State of Wellness, which is stateofwellness.org. For those of you who haven't stopped by and visited, we did just add some a forums page. So if you want to register for State of Wellness, you can add or ask questions there, and get some conversation going. It's brand new, so. Teresa, I think you should probably put something out there so then no one has to be the very first to do it.
I'll do it. Today.
And Amy, I hope you'll come and.
I'll be looking. I'll be
others. Yeah. So and Amy, I hope you'll come and answer some of the questions that may come up, for you. People, after the fact have the greatest questions.
Yes, that's usually when I think of them too.
Oh yeah, me too. Me too. So, anyway, and Teresa, do you want to talk about what's coming up and our fun little T-shirt contest?
Oh, I do. I would love to. We've got lots of exciting things coming up. I first wanted to mention that the next webinar, May 19th, State of Wellness webinar, is Jacqueline Chang and Christopher Tompkins from California. And they're going to talk about, well, actually it's entitled Mission Possible, Creating Worksite Wellness Programs in California. So that sounds really interesting. That one's coming up. And then June 16 is the Spirit of Cooperation, a webinar rally that many of you that are on the CDC listserv that we use may have seen that. But Jason Lane with CDC is going to be doing that webinar. It's going to focus on the CDC Worksite Wellness tools. So he's going to be going into detail and sharing what all is out there for not just those that work in the state government worksite wellness initiatives like us here today, but we'll really focus on those tools that individual companies can use. So it'll be an excellent opportunity for people like myself and like Amy and others on the webinar to promote into the states and each of our states and pull in individual private companies. And so we have a challenge that the state that has the most participants from your state on the June 16th webinar will be the winner and receive a free continuing education credits on chess and ACSM and a State of Wellness t-shirt.
Yay,
so
t-shirt.
You'll be declared the winner. So those two really big things coming up. And then there's additional webinars after that that we'll be putting out more information on that really soon.
I know, it's like how many t-shirts can you really use? But this will be like the only State of Wellness t-shirt that exists in the world. It'll be a highly coveted t-shirt. So anyway, so thanks everyone. Have a great day. Happy almost Friday. Thanks again, Amy, Teresa.
Sure.
You guys have a good Easter weekend.
You too, Michaela. Thanks.
Thanks. Bye-bye.
Bye.